So my name's Luke. I'm one of the respiratory research nurse managers at Wythenshawe Hospital. So I help lead the team that delivers respiratory research in areas such as COPD, asthma, bronchiectasis, and now we're doing a study in chronic breathlessness. So I'm just going to give you a bit of an overview of this study, and we've just started in the last month. So we're looking for participants who meet the criteria and are interested in sort of helping us in this area of chronic breathlessness research. So the study is called Self-Breathe. So how this came about is that chronic breathlessness is one of these problems that affects people with many different background conditions. So patients like yourself, lung cancer patients, bronchiectasis, asthma, COPD. It's an area, heart failure as well. It's an area that covers all those diagnoses. And we think that around 3 million people suffer from this in the UK. And then things like COVID have come along, and we've had people with long COVID, with chronic breathlessness symptoms. And we're finding more of this as time goes on. So the people with these symptoms are sort of increasing. And then this all leads on to these things with people with chronic breathlessness, poor quality of life, increased disability, higher use of healthcare through the GP, A&E, patient admissions, and all the additional costs of that. So what this study came about from is that participants or patients with chronic breathlessness are already on the correct medications, say the right inhalers, the right nebulizers, etc., the right antibiotics. They're already on the best ventilation techniques if they need the extra oxygen or the high extra pressure through oxygen machines. But we're limited in the fact of the physio interventions or breathing exercises that we can do. So most patients might come in every 3, 6, 12 months for sort of a follow-up with the physio and the medical team, but that's clearly not enough when these patients could have this need for these extra breathing exercises. So Self-Breathe came about to sort of fill that gap with a sort of self-management program. That's an online program which delivers physio interventions through breathing exercises, how to monitor your breathlessness, how to sort of plan and act when you have like a breathlessness attack. So this is a bit about what the platform sort of looks like, and a few sort of reviews that patients who have been on this previously in other trials have found. So most people have found that it's been effective to sort of increase their exercise tolerance. They've added bits of expertise into sort of breathing techniques that they've not seen before. And someone at the bottom saying like having a breathing attack, it's been like a handy sort of resource of extra information. And it's also got a nice part where you can ask a professional. So this app's linked to physios and medics and nurses. So if you've got questions about your breathlessness, you can ask someone through the app and they can get back to you about certain questions. So this trial is it's a randomized trial. So that means if patients meet the eligibility, we would randomize them to either receive access to the Self-Breathe platform for 6 weeks or to standard care, which wouldn't be access. And then we'd like to compare those two groups through different questionnaires to see if this access to this app reduces their breathlessness following the 6 weeks. So we would do a questionnaire at the start. They would have the 6 weeks of the Self-Breathe app or 6 weeks of standard care, and then we would repeat the questionnaires at 7 weeks and 12 weeks. And we would collate that through other hospital sites in the UK and see if there's an actual benefit to this application. So the primary objective is this study is to see if this Self-Breathe plus usual NHS care for 6 weeks reduces like the worst breathlessness over the previous day through various questionnaires. The participants we're looking for are all adults, patients with chronic breathlessness at risk or exertion, and we are classifying the chronic breathlessness as people with this MRC score of greater than 2. So that's people who are short of breath when hurrying on the level or walking up a slight hill, and anybody above that. And then someone with a defined cause of the chronic breathlessness. So that can be lung cancer, COPD, cystic fibrosis, asthma, aspergillosis patients, anything that's got a defined cause of why they've got chronic breathlessness. Oh, excuse me. And then we'd obviously need access to a computer or a tablet or smartphone, and then the ability to provide informed consent. It's got a few exclusions, so we need people to have a breathlessness of a defined cause. So if you have chronic breathlessness but you don't know the cause, we can't unfortunately allow you entry into the study. People with a primary diagnosis of chronic hyperventilation syndrome, but this is more common in sort of asthma S patients. And then we can't recruit patients who are currently in a rehab program because we don't know how that would interfere with the data we'd collect on the intervention. So as we said, these are the sort of primary outcomes we're looking for. So improvement of worst breathlessness over 24 hours, and then some secondary outcomes about how breathlessness affects activities of daily living. So things like how you wash, dress yourself, how you can socialize, etc. Quality of life questionnaires, use of sort of healthcare. So does using the app reduce people's contact with the GP or A&E, etc. And then we'll do sort of reviews of how people think of the app and if they think it's useful. This is just a bit more detail about sort of what we'll cover during the trial. So these are basically all the questions we would cover, and it's a booklet that probably takes about 20 minutes to complete. Most patients with breathlessness might have completed some of these questionnaires in the past. So we would complete them when you first sign up to the trial at 7 weeks and then 12 weeks. This is just a bit of a screen that shows sort of what the website app looks like. So it's a mix of videos, which go through educational techniques for breathing exercises, how to sort of formulate an exercise plan for yourself, how to sort of do a breathlessness plan. So when you're having a breathlessness attack, how to sort of best formulate that for you. There's the Ask a Professional part of the app, which I mentioned before, where you can send questions through to physios, nurses, doctors about any questions, and they can get back to you. And then this is just a few examples of what the app would look like in regards to sort of recovery breathing, the forward lean sort of techniques for when you're having a breathlessness episode, things that can sort of help with breathlessness, such as like using a handheld fan or using flannels or cold things. So that's just a whistle-stop tour of the self-breathe platform that we're offering at Winshaw. So the study's open for the next year or so. And I've put my contact details here, and I'll get Beth to send out. I'll formulate a bit of a summary that Beth can send out to you all after. And if you're interested,
I'll put it in the Facebook group.
Yeah, that would be great. Thank you, Beth. And if you're interested in taking part, you can contact myself on my email, or you can give my office. This is my office number. Give me a ring, and we can have a chat about the study.